Can you wear a scoliosis brace to bed? Scoliosis braces are worn as a facet of non-surgical scoliosis treatment. And a scoliosis brace is basically an orthotic device worn around their torso as a goal of trying to slow down curve progression and potentially improve spinal alignment. There are many different types of braces with many different designs and many different end goals. And the potential effectiveness of the brace really depends on wearing instructions and the design of the brace. Now, when we look at different types of braces, some braces are designed to wear mostly during the day, some braces are designed to wear mostly at night, and there are some braces that are designed to kind of be worn both times. And these braces are really depending upon the design of the brace, the goal of the braces, and what they're designed to do to help the person with their particular problem. Now, we know some braces, because they're designed to specifically worn only during sleep, those braces normally are not effective to be worn standing. And when we look at braces that are worn during sleep, these are typically called bending braces. Now, bending braces can also have many different names behind them, like a Providence brace, a Charleston brace. These braces normally bend the patient into like a bending position, so it's very difficult for them to wear these braces full time or during the day at all, because the person has almost impossible for them to stand properly. These braces are designed to place the spine into a bending position, like I mentioned. And however, since it doesn't account for spinal movement or activity during normal motion or awake hours, these nighttime braces can be very challenging, like I mentioned, to wear during the day. In addition, since they put a patient in this overbent position, they can sometimes be very difficult to even wear at nighttime for any level, because patients have a hard time sleeping in these types of braces effectively because they're in this bent position. So compliance can be a very significant problem. When we also look at compliance, we know that compliance with bracing can be challenging even for these non-bending braces, because scoliosis can affect all ages. However, the most typical patient that is braced traditionally is going to be an adolescent patient, typically between the years of 10 years of age to skeletal maturity, so 10 to 18 or so. And these adolescent groups are unfortunately very vulnerable to body and self-image concerns. So therefore, as growth triggers progression in scoliosis, these adolescents, as they start going through rapid puberty, are at the greatest risk for progression. And a brace sometimes can alter their perception of themselves, meaning if they have to wear it either at night, during the day, or a combination of the two, because they can sometimes be hard to completely conceal. And adolescents kind of want to fit in with their peers. They don't want to feel different. And by wearing this brace, it can sometimes affect what they think of themselves. Bracing can sometimes also be uncomfortable if designed improperly, meaning they can cause difficulty to take deep breaths in. The patients can feel like they have to take shallow breaths, or it could be hard for them to participate in certain activities. But in order for any brace to be effective, there's one bottom line here, is that it has to be worn. If a brace isn't on and the person can't tolerate the brace, therefore there's no way the brace is going to be effective. A brace sitting not on the person is ineffective in treatment. So therefore, getting a brace that's functional but also a patient can tolerate is a very important consideration. There's a very significant difference between what I call traditional bracing and modern scoliosis bracing. Now, traditional bracing typically uses one of two types. The one I mentioned was the bending brace that's only used for nighttime use. And then a second type tends to be a Boston brace. Now, a Boston brace is a big category for a lot of subcategories of braces in here, but Boston braces are typically prescribed more of a full-time basis, meaning 18 plus hours a day. And these braces are typically worn until a patient hits skeletal maturity during this growth phase. Normally, these braces are only used during adolescent stages, because these braces, the goal of these braces are just trying to slow down the progression. They're not trying to reduce the curve, make the curve better, improve function, improve pain. And these braces are very limited because their design is more two-dimensional. They're just trying to squeeze the body or squeeze the spine to hold it while the person is actually growing and developing. Unfortunately, scoliosis is truly a three-dimensional condition, and the rotational component is not addressed in this two-dimensional approach. So therefore, traditional bracing, by the fact of just squeezing the spine, trying to make it look straighter, can also have some negative effects, because the squeezing effect potentially could weaken muscles and tissues over time. And these Boston braces unfortunately are very similar in design despite of what the patient presents with. They look almost mass-produced, that if you have one person and another person with a Boston brace, they can have two different completely curves, and they potentially could share braces because they look so similar. These braces tend to extend very low into the low back and into the buttocks area, very difficult to sit. And normally as curves are progressing during the use of this type of brace, these braces become less and less and less comfortable to wear because the patient's curve is actually getting bigger. And that's actually a very common sign of the curve worsening, is because the brace is getting harder to wear. Now, modern corrective bracing has many different types of benefits that this typical Boston brace or traditional bracing doesn't have. And modern conservative bracing really addresses all the shortcomings I just mentioned. And there's many different types of corrective braces, but the one I tend to use the most is something called Scoli brace. And Scoli brace allows me to have an influence on the design of the brace, and allows me to have the culmination of all the things that I've learned with scoliosis over the last 25 years and incorporate this into the brace so the brace can be very effective. Now, these types of braces are fully customized, and they use state-of-the-art body scan technology, making these braces as comfortable and as minimal as possible to the patient, meaning they're going to interfere as little as possible. They also are easier to conceal because they don't extend as low into the body and their clothes. However, they are still a brace, meaning they still have to be applied. And because these braces are fully customized, we're not limited by designing a brace in any shape that's going to provide the very best results for the patient. So some braces look very different relative to somebody else's braces, and these braces cannot be shared across different groups because there's just no way they're going to fit the person. These braces also address the true rotational component by addressing the spine in a three-dimensional manner. And we try to address the spine in all facets, in the compressive facet, in the rotation, and the bending. And these corrective braces work by pushing, not squeezing. And this push creates a reaction within the body to create a better improvement. Now, all these braces I mentioned, the nighttime brace, the Boston brace, even modern corrective braces, all of these braces potentially could be worn to bed. And most of them have to be worn to bed to have an effective dose. And even with modern conservative bracing, we're not limited to just adolescents. We can also use these braces in adult patients to help improve their spine in the adult stage. And in fact, most adult patients prefer just to sleep in their brace. So therefore, most patients, if they have a good brace that's designed well and it's being effective at reducing their curve, most patients find sleeping in it or wearing it to bed actually the easiest component of wearing the brace. So therefore, scoliosis bracing, for it to be effective on a growing spine, it must be addressing the spine in a corrective manner. And normally, in most cases, most patients are wearing these braces to bed, despite the fact they may not just be a nighttime specific brace. Now, modern conservative bracing can be worn to bed and also be worn all day long as a result of reducing the spinal curvature and trying to improve the size of the scoliosis. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.